good healthcare is expensive in Nigeria, I would say is because setting up a health facility, hospital, laboratory is so expensive. I think we can all afford some form of it, right? I think we can all afford it. It's about planning and just being a bit more strategic about how we allocate the resources that we have. Whatever it is, just know that when you pay for health insurance, good health insurance anyways, you're able to access care on time, you're able to access care at such a reduced amount of money. And in some cases, in many cases, you might not even pay anything at all. Hi everyone, welcome back to my YouTube channel. In today's video, I'll be talking about health insurance, especially for people who are working and all of that. Health insurance is something that is so dear to my heart, especially because there's several stories of, people needing so much money for medical treatment and all of that at such an exorbitant amount of money, and paying out of pockets for for illnesses and all of that is so expensive. Good healthcare is extremely expensive, and I just want to talk to you about having a health insurance. Now, why is healthcare so expensive? I've worked in healthcare before, and I think I understand a bit of why you go to the hospital and they're telling you to do a test, maybe to use the CT scan. You're there for like 5 minutes and you're wondering why they're charging me 100,000 naira. First of all, it's because healthcare equipment are extremely expensive. And so for hospitals or healthcare providers, when they purchase this equipment, recouping their money back takes such a long time, And so how else can they ensure that they make that money back and make it back within a reasonable amount of time, right? It is to put that money on patients, right, or on customers that will visit the hospital. Another reason healthcare is expensive, or good healthcare is expensive in Nigeria, I would say, is because setting up a health facility, hospital, laboratory is so expensive. Getting the building, getting the place itself up to standard, even to the flooring that is used it costs a lot of money. And then getting, of course, healthcare professionals that will work there, you have to pay them a reasonable wage. So these are some of the factors that have increased the cost of healthcare in Nigeria. And a Nigerian is one sickness away from poverty or bankruptcy, right? But one way to cushion the effects of medical bills is getting good health insurance. Now, imagine you have two job offers, one that gives you health insurance, good health insurance, and the other one that does not have a health insurance. Trust me, if you're sure that, okay, this organization's health insurance is really solid and standard, and the pay might be lower in comparison with, another offer that you have, I would advise that you go for a job that has good health insurance, especially if you have family, if you have maybe a spouse and children. Look, the amount of money you spend going to the hospital, paying for tests, paying for this, paying for that, when you calculate it, it's nothing. It's so much more compared with, the difference in money that you'll be paid monthly. So it's advisable to always put health insurance in consideration when you're taking a job offer. It's extremely important. I can never overemphasize it. When I had my son, for example, when I was pregnant, from the time I was pregnant for him up until the time he delivered, the amount of money I spent would probably be, say, 50,000 naira, and that was because I'd exceeded the number of times I could do a scan under the health insurance plan that I had within my organization. So that was the only thing I think I remember paying out of pocket for. And of course, my antenatal drugs and all of that. But aside that, from the antenatal care to seeing the gynecologist every week that I went for antenatal, to the hospital bed, to the number of days I spent in the hospital and all of that, blood tests and all of that, I paid nothing. Now imagine that every single time I go to the hospital, I'm billed every time I need to see a gynecologist, and I had a special case. Anyways, not to delve into that, but I needed to see the gynecologist every week, and he was available every week, and I saw him every week. Imagine every week I had to pay for his services. First of all, it's a specialized service, and what that means is that it's not just going to be maybe consulting fee for a general practitioner. It would be paying specialized fee every single time that I visit him. And that would have, of course, been so expensive to pay for. I see several, working people, whether businessmen and all of that, not having health insurance. And I just want to say that if you can afford it, I think we can all afford some form of it, right? I think we can all afford it. It's about planning and just being a bit more strategic about how we allocate the resources that we have. So if you're doing a business, if you are a freelancer, if you have a job and you don't have health insurance, there are several HMO companies that offer very affordable health insurance plans, depending on what you can afford, right? So please take advantage of it. Take advantage of the systems that we already have. Another advantage of having health insurance really is that when there is an emergency, there are several hospitals that one has access to. There are thousands of hospitals under its plans anyways, and of course, the amount of money that you're paying determines the kind of hospitals that you have access to, right? But if there is an emergency and all of that, and you find yourself in, say, another environment and you need to use the hospital, the good thing is if you have an HMO that has large coverage, right? Even if you're not in your designated hospital, you can always go to another hospital to actually seek for help, right? It is cheaper, it is more affordable, and some people have this belief that, oh my God, I don't fall sick, why do I need health insurance? It's possible you might not even use you might not even access the hospital in a year. I'm using a year because the payment is usually within a year period, right? You might not access you might not even need the service at all. But the advantage of it is that your money is paying for somebody else, right? You're not accessing care in a facility, but somebody else is able to provide services for another person, right? And so that's the beauty of health insurance. You're paying for somebody else and somebody else is paying for you. I don't know if that makes sense. So it's a pool of money, right? And it's based on, it's done, should I say, based on probability, such that the chances that I will fall sick and you see the hospital 5 times is maybe 10%. Somebody else's own might be 90%, depending on underlying health conditions and really just life in general. Now, I may not access care as many times as you will, but what I've paid for is helping somebody else be able to access care. Whatever it is, just know that when you pay for health insurance, good health insurance anyways, you're able to access care on time, you're able to access care at such a reduced amount of money. And in some cases, in many cases, you might not even pay anything at all. Of course, each plan is dependent on the amount of money you're paying and the kind of care, the level of care that you're going to be accessing it varies depending on the plan. So you might have access to more services on plan A and access to lower services on plan B. So look out for HMOs that are available and just avail yourself of it. I'll be talking about a few health insurance plans that I have done some bit of research on and all of that. Now we have AXA Mansard, there's Leadway, there is Avon, there is Hygia. There are several health insurance companies in Nigeria. And many of them, if you go to their website, you can see the plans there for individual, for family, and all of that. I'll just give examples right now. For AXA Mansard, they have goals plan of about 86,000 naira to their most expensive plan, which is almost 2 million naira per annum for an individual. There is also Leadway that has a plan of ranging from strawberry to raspberry with a price range of about 104,000 naira to about 900 and something thousand naira, right? We also have Reliance HMO. They have, I saw 2 individual plans on their website. They have Serenity Life and Serenity itself, ranging from 340 something thousand naira to almost a million naira, 930 something thousand naira. Each of these plans that I've mentioned are individual plans, and they are for a year. And please, just a disclaimer, do your own research, right? I'm not here to advertise any health insurance care for you. I'm just giving you a price range to let you know that it's not as expensive as you think. Anybody can afford it, really. Well, maybe not anybody, but to an extent, look at the one that you can afford, right? So you can buy plan for your family. I think they also have bundle plans for family members, maybe a family of 2, 3, 4, and all of that, depending on the number of people that you want to put. I mean, I've done like an Excel folder that sort of compares all of the individual plans. I'm emphasizing individual plans now. I'll put the link somewhere where you can download it, right? And you can also visit the website. I think on that Excel sheet, the link to the websites are also there. You can also give them a call just to find out about what their plan is and all that, and just determine what is best for you. I also want to say that for people who have domestic employees and all that at home, you have a driver, you have a housekeeper, and all of that, you can buy health insurance for them. It saves you time, it saves you stress, it saves you lots of money, and I think it's something that everybody can have. I also want to say that all of these health insurance companies, they also have plans for the elderly. So you want to buy for your parents, you want to buy for your loved ones, your aunties and your uncles and all that. For people who are living abroad, right, you're concerned about your parents' health, you can just check out the website, look at the plans that you can avail yourself of, because the cost is lower. It's lower. And I don't think there is any disadvantage, right, in having health insurance. When you're about to maybe be onboarded on health insurance or on a health insurance plan, they'll ask you if you have underlying health conditions. Now, what I've noticed, right, is that some already existing health conditions are not covered until after a year. Let's say maybe things like diabetes, hypertension, and all that. If somebody already has that, you're going to have to wait for about a year before it will be covered, and things like that. If you're a family person, you're single, whatever, please get health insurance. The amount of money you will spend in the hospital, when you're down with just one illness, honestly, it will wipe out your savings, it will wipe out your investments, and everything you're keeping to have a better future for yourself. And also, we should not forget that our vehicles, our bodies are the vehicles of destiny. If we're not fine, no matter how ambitious we are, no matter how much money we plan to make, no matter the plans we've written down and all that, it starts with health. So our health is so important, and we must cherish it, and we must cater for our bodies. So thank you, everyone, and I hope you get health insurance. If you have any questions, let me know. Put it in the comment section. I would answer as much as I know, and maybe refer you to the website as well. So thank you, everyone, for your time, and see you in my next video. Bye.